CPO Certification Practice Test 2026. Question 1. Which part of the eye is responsible for color vision? Rod cells, cone cells, sclera, cornea. Cones are concentrated in the macula and handle color and fine detail. Question 2. What is the term for farsightedness? Myopia, hyperopia, astigmatism, presbyopia. Hyperopia occurs when light focuses behind the retina. Question 3. An optometrist primarily has which degree? MD, DO, OD, PhD. Optometrists hold a Doctor of Optometry, OD, degree. Question 4. Which instrument is used to measure intraocular pressure? Ophthalmoscope, tonometer, phoropter, retinoscope. A tonometer is the standard tool for checking eye pressure, IOP. Question 5. What is the blind spot of the eye? Macula, fovea, optic disc, iris. The optic disc has no photoreceptors, creating a natural blind spot. Question 6. Which condition involves the clouding of the eye's natural lens? Glaucoma, cataracts, macular degeneration, conjunctivitis. Cataracts cause the lens to become opaque or cloudy. Question 7. What does OD stand for in a prescription? Left eye, both eyes, right eye, overdose. Oculus dexter, OD, is the Latin term for the right eye. Question 8. Which layer of the eye contains the blood vessels? Sclera, retina, choroid, cornea. The choroid is the vascular layer between the retina and sclera. Question 9. What is presbyopia? Nearsightedness, age-related loss of near focusing, irregular corneal shape, crossed eyes. Presbyopia is the natural loss of flexibility in the lens due to aging. Question 10. Which drop color usually identifies a mydriatic, dilating, agent? Green, red, tan, yellow. Red caps are standard for mydriatics/cycloplegics like atropine. Question 11. A phoropter is used to measure internal eye pressure, refractive error, visual field, retinal health. The phoropter is the device with many lenses used to determine a prescription. Question 12. What is amblyopia? Lazy eye, double vision, night blindness, drooping eyelid. Amblyopia is reduced vision in one eye due to poor development. Question 13. The Snellen chart is used to measure color vision, visual acuity, depth perception, peripheral vision. The Snellen chart, letters, measures central visual acuity. Question 14. Which structure controls the amount of light entering the eye? Lens, iris, retina, vitreous. The iris adjusts the pupil size to regulate light. Question 15. What is the clear, watery fluid in the front of the eye? Vitreous humor, aqueous humor, tears, plasma. Aqueous humor fills the anterior and posterior chambers. Question 16. Pink eye is the common name for glaucoma, conjunctivitis, keratitis, uveitis. Conjunctivitis is inflammation of the conjunctiva. Question 17. A person with legal blindness has a best corrected vision of 20/50ths, 20/100, 20/200, 20/400. 20/200 or worse in the better eye is the standard for legal blindness. Question 18. Which lens type corrects astigmatism? Spherical, cylindrical, prism, Bifocal. Cylindrical lenses correct for the irregular curvature of the cornea/lens. Question 19. What is the primary risk factor for glaucoma? High sugar intake, elevated intraocular pressure, lack of sleep, reading in low light. High IOP is the most common treatable risk factor for glaucoma. Question 20. The Ishihara test is used to detect depth perception issues, color blindness, macular holes, corneal ulcers. Ishihara plates use colored dots to test for color vision deficiency.